Hello, my name is Grace Chu. I'm a nurse practitioner from an emergency department in Australia. I'm also a nurse researcher from University of Queensland and a wellness champion of our department. I strongly believed staff well-being providing stability and the longevity of our workforce. Working in emergency department is stressful, and the management of stress is important. As a wellness champion and a researcher, we wanted to know what stress reduction intervention has been tested previously and which intervention is more effective for our emergency staff. This is why we conducted this study. In this systematic review, we used the GBI method to focus on quantitative studies published in English between 2008 and 2019. 14 studies included into this review. Study breaking down into two categories: individual-based intervention and organization-directed interventions. Individual-based intervention refers to strategies that promoting staff tolerance and coping strategies in managing staff stress at a workplace. It includes educational style interventions, for example, compassion resilient training workshops, and mindfulness-based intervention, for example, face-to-face mindfulness training. Both educational style interventions and mindfulness-directed interventions had the potential to reduce both stress and burnout. As a wellness champion or frontline clinician, you may be more interested to know how to apply these findings into real practice. Individual-based interventions are more cost-effective to implement, which require less resources. They tend to be more adaptable into an environment of individual ED. If ED clinicians or wellness champions led these interventions, it tends to be more effective and have a long-term effect. In contrast to individual-based interventions, organization-directed interventions tend to require more resources and involve more stakeholders, which may make it difficult to implement. I hope you find this review is useful. If you are interested in more about the studies, please read through the article. Good luck to you for any wellness initiatives you may embark on. And also, I want to thank you on behalf of your colleagues for looking after their well-being. Have a good day.